Welcome back. To warm us up for the upcoming panel discussion, we're going to hear from Claire Phelan, Net Zero Travel and Transport Project Manager for NHS England. Claire has extensive NHS experience at several large London trusts, working in a clinical capacity before moving into tactical response and sustainability. Throughout her clinical career, Claire treated respiratory patients, witnessing the health impacts of climate change firsthand. She's now part of the Net Zero Travel and Transport team at NHS England, who are responsible for the decarbonisation of all aspects of travel and transport across the NHS in England. So, welcome to you, Claire, and it's over to you.
Thank you, Helen, and thank you for everyone for taking the time to be here today. As Helen mentioned, I'm Claire Phelan and I work in the Travel and Transport team at NHS England. And our team have been tasked with the decarbonisation of all aspects of travel and transport across the NHS in England. So that is everything from the staff commute right up to our blue light ambulances. So just that small challenge. So I have always felt protective of our environment, and my sustainability journey began unconsciously when I was about 4 years old. I made the link between animals and food and refused point blank to eat meat. My poor mum was in despair back then in Ireland. Back in the day, the diet consisted of pretty much meat and potatoes, but she said there was no reasoning with a stubborn 4-year-old who loved animals. So that was that. A couple of years later, I remember distinctly watching a documentary, and this particular polar bear had a cub, and the ice around them was melting, and I was devastated. And by this point, I was old enough to understand the impact and what was going on. And it was then that I actively made the decision to reduce my contribution wherever I could. So I continued to be conscious of my choices, but never pursued an environmental career, mostly because the career guidance at my school was limited and I didn't really know what was possible. But fast forward a few years and I became a physiotherapist. So when you think of physiotherapy, most people think of sports massages and sports injuries, but that's actually only one small part of one type of physiotherapy. I spent a lot of time working in respiratory care, as Helen mentioned, where we work on ICU treating lung conditions such as asthma, bronchitis, respiratory failure. And I was a specialist in pediatrics, so I worked predominantly with children. I've always had some awareness of climate change and air pollution and the impacts on health. But as my career progressed and my knowledge and understanding of this became stronger, and witnessing the effects of this firsthand, I felt that it was my responsibility as a clinician in the NHS to do more for our patients. Next slide, please. So the NHS is the UK's largest employer, but it's also the 5th largest employer in the world. And it's responsible for 3.5% of all the road travel in England. According to the World Health Organization, poor air quality is the largest environmental risk to public health in the UK. And in 2017, it cost the NHS over £40 million. And this number only continues to grow with new figures being released. Air pollution causes approximately 7 million deaths per year. Now, just to put that into context for you, that means that there are more deaths per year from air pollution than the total global number of deaths from the COVID-19 pandemic since it started, which is massive. It's difficult though, because the effects of air pollution are not always visible, like long ED wait times. But the burden of air pollution on the NHS is mountainous, and we need to address this if we ever want to reduce the overall burden on the NHS. When people think about net zero, there's great hesitance that it will place pressure on an already stretched NHS. But let's just think about this for a moment. Winter pressures are an annual event which overwhelm the NHS, and respiratory exacerbations are one of the key factors in this umbrella term of winter pressures that contribute to this increased strain. We know that respiratory conditions are worse in cold weather, but what else correlates with cold weather and the increased severity of respiratory conditions is air pollution. This is due to a number of factors. It's cold air trapping pollution particles for longer, increased congestion and car idling. But we rarely attempt to make the links to the root cause. Instead, we continue to respond to this annual burden in a reactive way. So what will it take for the net zero agenda to be seen as urgent and as a priority? And just some really stark statistics from asthma in the UK. 40% of babies born each year are delivered in hospitals that are surrounded by toxic levels of air pollution. So this means that their first breath that they take in the natural world is toxic. And recent research has also discovered that air pollution particles exist in the lungs and brains of unborn babies and affect development. So even before they've taken their first breath in this world, they're being exposed to air pollution and the negative impacts of this. Next slide, please. Many of you may know this face, but this is 9-year-old Ella Adu Kissy Deborah. And Ella was the first person to have air pollution listed as cause of death on her death certificate. Health conditions are visible, but the link to air pollution is not often made. It's masked with diagnoses such as recurrent asthma exacerbations, like Ella. But why are we not asking what's causing these asthma exacerbations and addressing that cause? Massive inequality exists within this space. We know that those of lower socioeconomic status and the most vulnerable members of our community are disproportionately affected by air pollution. They're more likely to live in congested areas, and a lot of them don't drive themselves, and they have poorer health outcomes generally. I just want to draw your attention to 3 of NHS England's values: working together for patients, improving lives, and everyone counts. So why are we not doing more to clean our air and protect those most at risk? It's our responsibility as a healthcare provider to take action to protect our staff and our patients. Next slide, please. So in saying that, it's not all doom and gloom. That might sound a bit grim, but not all is lost. This is complex because it's unknown, but that also makes it exciting. We've been presented with a unique opportunity to change our trajectory if we choose to take on that challenge. So my team, the Net Zero Travel and Transport team, have been in existence for just over a year now. And we have met so many determined and passionate individuals and teams, and we're building links and driving this forward together. This is just some of the brilliant work that's been happening in this space recently. So we have the world's first fully electric operational ambulance on the road, and there are 11 more due to hit the roads this year, which is fantastic and really exciting. Our zero emission emergency vehicle pathfinder program funded 23 electric vehicles, which are a mix of rapid response vehicles and mental health ambulances. And this has resulted in one of the trusts committing to fully convert their fleet to electric. We're seeing an evolving trust in electric vehicles and a willingness from people to embrace change and drive this forward. And part of my puns in here, you get a lot of this in the travel and transport space. Next slide, please. So the question posed to myself and our panel today is, what does the future of travel and transport look like in the NHS? Well, that is a broad and complex question. Like the COVID-19 pandemic, this is uncharted territory and there's no how-to guide. Some elements will be easier than others. For example, the trajectory for greening our fleet will be led by government mandate, and grey fleet will naturally follow the public trajectory. We have determined some starting points, like the need for trust and NHS organisations to do a deep dive into their fleet requirements and determine how best this can be optimised. We do know that the future needs to be a combination of various interventions, such as modal shift and taking into account the travel hierarchy that you see on the screen there, and greening our fleets. Because, no problem, because converting all our car journeys to electric is not sustainable and does not address the current issues that we have with congestion. Our team are doing everything within our power to support NHS organisations to transition to net zero travel and transport. What we don't necessarily know right now is what the route to get there will look like. We can set targets and we can make assumptions, but this is a rapidly evolving space and we need to be agile. There is a need to start thinking differently and changing our behaviour. Systemic change is imperative to this. People always choose the most convenient option for travel and transport. So how do we change mindsets and how do we empower people to choose a more sustainable option? How do we make these convenient? We don't have all the answers, but working collectively on this is crucial. We need to move away from silos and work in a joined up way. We all have a part to play in this. Leading into this debate, I want to encourage people to think critically with an open, solution-based mindset. So is converting all of our fleet to electric the answer, or are we putting all of our eggs in one basket? We know electric vehicles produce no tailpipe emissions, but what about particulate matter from tyre and brake wear? What do we do about that? There is no golden ticket answer. This is a complex problem, and complexity requires a degree of flexibility and adaptability, and it will take time. We're on a journey of discovery, and we just need to keep moving forward. We won't always get it right first time, but we'll learn and we'll grow along the way. Yes, this is difficult, and yes, it's uncertain. We know this, But what happens if we put this in the too difficult pile? Nobody joins the NHS for an easy life. We're part of our National Health Service because we care about people and equality, and it's our responsibility to act now for our staff and for our patients. Next slide, please. I just wanted to leave you a quote that really resonated with me, and it is a bit random, but I discovered this quote when I went down an Arnie hole when I learned that he lived with a pony and a donkey and they came to eat dinner with him. Anyway, the quote is, "We simply must do everything we can in our power to slow down global warming before it's too late. The science is clear, the global warming debate is over." But that point specifically, the science is clear, the debate is over. I think that's a really critical point. This isn't up for debate. The question isn't if we do this, we simply have to do this. So how do we make this happen, and what will the future of travel and transport look like? It's up to us to decide. Thank you.
Well, thank you, Claire, for giving us an insight into the work you're currently focused on, and also sharing the personal story behind it and talking about your time as a clinician, which brought it all to life for me, thinking about asthma and the benefits of clean air too. And Claire has managed to set the scene very beautifully for our final discussion, looking at travel and transport and the benefits that effective planning has in working towards reducing carbon emissions in the network. 3.5% or 9.2 billion miles of all travel in England can be attributed to patients, staff and suppliers delivering stock or travelling for business purposes, going to appointments, etc. This amount of vehicle usage equates to around 14% of total NHS emissions, of which 4% is business and fleet transport, 5% patient travel, 4% commuting and 1% for visitor travel. Transitioning to electric vehicles through an optional salary sacrifice is one benefit the NHS has already introduced for staff, and increasing the number of electric vehicles, such as ambulances, will also help. Further use of remote care, like virtual wards, will reduce the number of unnecessary journeys, which in turn will help contribute to reduced carbon emissions. Cycling and walking are also being championed to provide a healthier and more sustainable way of getting to and from trusts and hospitals. So to find out more about what's happening on the ground and to hopefully get some ideas and more inspiration, let me introduce you to our final panelists. We have with us James Bate, Senior Project Manager at the South East Greener NHS Programme, Stewart Cundy, Senior Transport and Travel Manager for University Hospitals Bristol and Weston, John Upham, Sustainability Manager, Oxford Health, and Jonathan Guppy, Non-Executive Director, South Central Ambulance Service. All questions welcome, as have been the case on all the panels. Well, hello to you, our final panelists. I can see you now. I've put my specs on. Stewart, I thought we might start with you, if that's all right. University Hospitals Bristol and Weston. You're right in the centre of Bristol, where my daughter's just gone to university. I gather you have very little parking facilities for your patients, staff and visitors. So I'm wondering, has that made you particularly creative with your travel plans? What have you been up to?
Yeah, so it has. It's made us very creative. Not only do we have very limited parking being a city centre hospital, we also have the clean air zone that came into Bristol on November the 1st, which was heavily supported by the consultants in the hospitals, especially the Children's Hospital, as Claire alluded to, with the people being born in toxic environments already. So we've done a lot. So one of the main things we've done with regards to car parking is we've introduced a robust policy where parking on site is only available for those staff that absolutely need it. So we're talking blue badge holders, staff that use their vehicles for work, and staff that work on social hours. Any staff outside of that aren't permitted to park on site. But to do that, we have introduced our own shuttle service that operates to one of the car parks out of town and the train station, which we've been running it for about 20 years, but all of a sudden it's become really popular.
Yeah, and a topic for discussion, I would imagine. John, at Oxford Health, what sustainable travel options are you trialling to reduce your carbon footprint and, of course, air pollution at the same time?
Oh, good afternoon, and thanks, Helen. Yeah, a couple of areas. Firstly, we just started a trial with electric bikes. So we've got our community team, we've got 3 members of staff that have kindly volunteered to trial some electric bikes. 2 standard electric bikes, and 1 is a cargo bike, which allows more equipment to be held and stored on the journeys. So it's a trial-breaking trial in that we're going to be monitoring this over 6 months with the university, looking at air pollution and looking at that modal shift with the community nursing team using an electric bike as opposed to their standard cars. They're GPS tracked, so we can monitor the amount of miles they're doing. And also, as I say, we're linking into the air pollution experts at Oxford University just to see how the trial develops in terms of health and well-being, and also benefits as far as air pollution, both air pollution and carbon emissions in the city.
Oh, and I'm guessing, John, that you'll probably be collecting data, will you, so that you can work out what impact it's making? And also, who are your partners in the trial?
Yes, so in terms of partners, we've got Oxford University together with Oxford County Council, the public health specialists within Oxford County Council, and also an independent cycle provider in the city. So it's quite, I like the idea of a sustainable option, which is it's a small independent trial with an independent shop in the city. But obviously the long-term aim will be to provide some valuable data to both the clinicians and NHS England as a whole, as to how the trial progresses, and certainly we'll get a lot of feedback from the community nurses as they go about their business in the city.
I'm sure you will. I'm coming to James and also to Jonathan in a second, but I just did spot there that Dan says that are the e-bikes likely to be used all year round or just seasonally? I think he's thinking of wet nurses and cold nurses in the winter.
No, we use the opportunity to start the trial in the spring when the clocks changed. So it only just started last week as the clocks changed. It will be for 6 months during the summer. As the trial progresses, we'll look at extending the trial into the winter months. But yeah, take that point on board. And it is about modal shift, and it is about transferring staff's behaviour, really, and that's the biggest challenge. Yeah,
James, let's find out what the Southeast Greener NHS programme is up to, if we may.
Yeah, of course. So we're a regional team. So our main engagement is with integrated care boards and looking at how we can sort of deliver projects at scale across the integrated care system. So I know Joe and Jonathan very well. They're in the southeast, so we work with them on the ground to understand what the barriers and challenges are around sustainable travel. So 2 main areas which I'd like to talk about today, as we often deliver more strategic projects rather than sort of the implementation of pilots like John has just discussed. And one area is around data. So last year we asked all of our trusts to submit a fleet return, which essentially was a summary of all the vehicles that are owned or leased. Looked at business travel as well, and looked at EV chargers. We got a good engagement. I think all of our trusts actually completed it. So thanks for John to do that, and likewise Jonathan. And Dan Wright, who I can see is posting comments as well. Special thanks to him. And we're using this data to really drive insights. So we want it to inform decision making. I think it's really important around assurance and data collection that it's fed back to trusts, that it looks at future planning and then it influences decisions made on the ground. So we're developing a fleet electrification dashboard, which will give a summary of the emissions profile associated with travel and transport at a regional, an ICS and a trust level. And it'll also give some insights. So we'll look at what your percentage of low, ultra and zero emission vehicles are, but also identify opportunities to electrify them. So for example, if we've got an aging vehicle, petrol, diesel, it'll give you sort of an indication on maybe it's time to switch to an EV. Likewise, if we've got a community-facing vehicle with low mileage, maybe look to doing what John's doing, which is switching it over to an e-bike. So a strategic dashboard, which again can future plan and support with that decision-making at a trust and ICB level. And then maybe in reference to what Claire was talking about in regards to air pollution, which is something that I'm very passionate about. We're working with an organisation called Global Action Plan who are the people behind Clean Air Day. And a couple of years ago, they developed the ICS Clean Air Framework. Now we're looking at regional implementation on this. And one of the key areas is that we're sort of collaborating with local authorities. So as hopefully you're aware, the integrated care system doesn't just include NHS providers, it actually includes working and collaborating with local authorities, blue light partners and academic institutions. And this is one real opportunity where we're really trying to drive that sort of strategic collaboration to tackle something which affects everyone, which is air pollution. So we're having key discussions between local authorities and NHS trusts to look at how we can align our plans and actually deliver something meaningful. So that's a project that's currently in the pipeline, and hopefully we can drive some impacts and some modelling later in the year.
Fantastic. I was just thinking, actually, when John and Stewart were talking, how wonderful it is when you've got a good, strong university in your city or town to involve university students, not only for their brains, but of course their generation as well, as getting, younger people who have grown up with this climate crisis, rather than some of us of a certain age, not you, who are a lot younger than I am, that's for sure. Jonathan, you've been very patient there, sitting, waiting for your turn. I have very close ties with London's ambulance service and air ambulance, actually, and have watched the London Air Ambulance start to introduce electric Mustangs, which I thought were very cool, into their fleet. What are you doing at South Central Ambulance Service to introduce electric vehicles, and how's it going your end?
Hi, Helen. Yeah, thanks for having me on. Can I just make one minor correction? That I'm actually the sustainability manager for SCAS. I'm not a non-executive director at the moment. So just to
we
clarify.
Just promoted you. Or?
Yes, yeah. Okay, so I can see my inbox starting to fill up.
Sorry about that.
So best just to clarify that. But not a problem. Yes. So in terms of SCAS, so our journey is we're still quite early days, really. And at the moment, we're focusing on the PTS and ensuring that we install electric vehicle charging to satisfy the PTS, and keeping a close eye on what other trusts are doing. Very interested to see how the electric ambulances pan out in terms of performance and any issues, and to learn from those experiences. But for us here, it's really, really important to do this because 85% of our carbon footprint comes from transport. So that's the ambulances, the PTS, and the grey fleet as well, people claiming business miles. And only 3% comes from actually heating the buildings, which takes a lot of people by surprise. We've actually got 101 sites. So it's a lot of buildings over a huge geographical area. But really, it is the size of that geographical area that is driving the emissions data for transport. So if we are to have any chance whatsoever of reducing our carbon footprint, we need to have comprehensive rollout of electric vehicles. And I sit within the estates department, so we're very much on the side of delivering the infrastructure to support the fleet as they purchase the vehicles. And we've only got, it's very, very early days, like I said, but we are starting a new rollout now, to do as many sites as possible. I'd say one of the big problems we've got, though, is, again, it's not just as simple as putting a charger in, just getting an electrician to turn up and stick a charger. We've got a lot of sites where there's only a single phase supply, and we're having to look to upgrade the actual electricity supply coming in, from single phase to 3-phase, and also to ensure that it's got the power output, the capacity to be able to drive the fast chargers, because obviously the faster the better. We need to have a quick turnaround on the vehicles. So that's a project that we're undertaking at the moment, to do a comprehensive survey of the sites, identify the best sites. We also, in terms of needing to know initially where most of the vehicles are, because this isn't going to happen overnight. So we need to use the data that we've got to put the chargers in the best place as well. So there's an awful lot of data collection going on and assessment, and then we can start the rollout of fast chargers as quickly as possible. Also, we're talking about just vehicles, and I did mention that only 3% of our emissions come from heating the buildings, but we still will have to decarbonize our estate as well. So when we're doing these upgrades, and this is really important for everyone else, is to make sure we don't overlook the requirements for decarbonizing the heating, when calculating electricity demands, because really don't want to go back and have to redo work. So it's really important that any electricity upgrades also take into account the future demands of heat pumps. Otherwise, that could be, again, wasting money, wasting time, as and when that's required as well. For us, that's going to be a bit further down the line, because our initial priority is dealing with the transport, 'cause by far and away the largest cause of our emissions. Another thing that's coming apparent as well, which is going to affect particularly ambulance trusts, is the way that the budgets are impacted as well. So, for example, at the moment, the fuel costs are going to be met by fleet, whereas as the estate is electrified and decarbonised, that's going to increase the electricity bill for estates. And so this conversation needs to take place within all the trusts who are going through this, is to how to manage that effective transfer of funding onto estates, so that those increased electrical bills can be covered. And then that also feeds through into things like data collection as to the vehicles, how are we charging them, how are we registering that against number plates, and how is that all going to be managed at the back end. So again, it's not quite as straightforward as perhaps some people might think, and it's really important at the survey stage that all these things are included, so that the back office function, how it integrates with finance, how managers can get data back on the vehicle performance as well. So all these things are really critical. So we're going through that at the moment.
Yeah, there's a lot of pain points in there. I mean, I've had personal experience of waiting on DNOs for power upgrades, and then the chargers keep, the chargers are changing and updating. And do you go for 7 kilowatt or 22 kilowatt, or do people now expect fast charging? There's a lot of stuff to take in there. Just bring Stewart back into the conversation though. Stewart, talking about the e-cargo bikes. I mean, can they replace journeys that would normally be made by petrol and diesel vehicles?
Yeah, they certainly can. We started a trial, quite ironically, in the winter on e-cargo bikes, and to be honest, the person that we're using to carry out the trial rode it all through every weather that we had, and he loved it, to be honest. But yeah, they can be used for the short journeys, last mile journeys, that sort of thing. We certainly, well, our trial's due to finish this winter, but yeah, we've got nothing but good things to say about it. It's replaced well, it's actually replaced an electric vehicle that has now replaced a diesel vehicle. So it was a long way round, but yeah, it's definitely, and it's able to cope with the demands of the service. I'm not sure how well you know Bristol, but our hospital is our Bristol Royal Infirmary is based at the bottom of a hill, quite steep hill, St Michael's Hill, and St Michael's Hospital is based at the top of that hill, and our e-cargo bike is used to take deliveries between St Michael's and the BRI and back up again, and it copes with it. So
only resilient
they
people
certainly
need
can be
apply.
used. Yeah, and just as a sort of second thing, our e-cargo bike was actually a vehicle ran up the back of it last week. And the e-cargo bike sustained no damage, whereas the vehicle sustained quite severe damage.
Wow.
So they're pretty robust in that way as well.
Yeah, they are. John, just thinking about the key challenges and barriers you may have faced, and how you approached introducing EV and infrastructure within the trust. If you come across some of the same issues that Jonathan's working through at the moment.
Yeah, I guess a couple of areas really. Initially, it's just looking at the infrastructure availability. One of the, I guess, looking at funding as well. It's that can always be a challenge around funding and reaching out to. There are opportunities to capture funding. It's just being in the right place at the right time to get that level of funding. We looked at a strategy around EV charging. Initially at our direct fleet, so looking at our 50 vehicles that we've got on the fleet and looking at a transition, but looking at looking at putting the EV charging in place, and then the 50 vehicles would then follow over the coming years by the end of the decade, in effect. So we've got about 6 charging points on the estate at the moment. One of the other challenges was seeking support from the property team, because obviously it takes away car parking spaces, and another emotive subject. But fortunately, we've got an executive lead who's our finance director, who's very supportive of the green agenda, and that's been pushed through. So we've taken away several car parking spaces to use for EV charging. But that can be quite challenging, because as you know, car parking is very emotive, and there's certainly expectation to provide car parking facilities. We're looking at this as a sustainable a transport sustainable journey. So it's not just EV, but it's more around, you know, active travel, public transport, walking, etc. But that whole sustainable travel package together, with EV playing a big part in that. Absolutely.
And do you find those chargers are usually occupied? Are people embracing, you know, electric and making use of the chargers you've put in?
To put that into context, at the moment, and reaching out to NHS Fleet, who are our main provider, about 80% of orders at the moment are electric for our staff, and also the charging points 100% optimized at the moment by staff bringing in their own vehicles. So as we transfer, we'll start to have more the charging points for our direct fleet, but at the moment they seem to be optimized by our staff using their own vehicles.
Be able to answer. Sarah says, are there any examples of modal shift from single occupancy car use to public transport and active travel in a very rural county where trust sites are 30 miles apart or so?
Was that directed at
I was
me,
just asking James if James felt he could answer that. Do you want me to say it again, James? Or
yeah, I think the sound went a little bit. Is that okay?
Yeah, I can hear.
Sarah was just asking whether there are any examples, and I'm just wondering if you might have any, of modal shift from single occupancy car use to public transport and active travel in very rural counties where trust sites are perhaps, you know, as much as 30 miles apart.
It's an excellent question. I think a common problem when you consider some of the trusts in London, you can jump on the tube, jump on your bike, and you're golden. In rural sites, it's much more challenging. I think it's fair to say that influencing travel behaviours is arguably the most challenging to try and influence. It's not like recycling, where you can put clear signage on and it's completely low risk. It's either in that bin or that bin. Trying to influence how staff members get to site, if especially it's habitual, you get in your car, it's warm, you know, you're going straight from A to B, and rely upon other infrastructure to get there. It's a big step to take, and this is why we are sort of often struggling to influence staff commuting behaviours. Everyone loves to drive. It's simple. If you take parking spaces out of a hospital, you're going to have people coming at you with pitchforks. So it's very, very, very difficult. But we have to use various different factors, which arguably in rural settings is much more challenging. Now, I don't necessarily have any clear examples, but I'm happy to catch up sort of after the call, and I can do a little bit of digging. But just to give some ideas over the top of my head, it requires planning, right? So it requires planning because you've got staff members here, there, and everywhere. So firstly, you need to conduct a travel survey to understand, well, where are staff actually based? So we've got a full, clear understanding of what's the locations and what's the current mode of travel from one place to the next. And then it's essentially planning, right? So understand when your shift patterns might be and how you currently get there. For me, I think lift sharing is a great opportunity. It's very hard to implement. There's been varying sort of degrees of success around sort of lift sharing, especially sort of after COVID, and people sort of maybe not willing to share that close confinement. However, if you realise that you're sort of within half a mile of 4 other staff members who are all travelling into work at the same time, why don't you all go together? It reduces the carbon emissions by 4. It means you have to spend less on petrol, and you could meet some new colleagues while you're at it. For me, that's a great opportunity. It delivers on various different elements of sustainability. However, what is required is firstly that level of data, and then the planning and sort of maybe some digital infrastructure to enable that lift sharing. For example, you might have an app and a QR code so you can share the cost of petrol. I don't know, whatever it might be. There's definitely examples out there which I can have a look into. But I think it requires those three main things: the data to know where people live, some future planning, but then also sort of the digital infrastructure to enable that lift share.
And just another quick question, James, for you. I mean, we said in the introduction that 1.3 million staff, NHS staff, travel to work. What modal shifts do you think have had the biggest influence on staff commuting behaviour?
It's a big question. What modal shift initiatives do I think have had the biggest impact? I'm going to answer an interesting one. I would say campaigning, right? So
Yeah.
campaigning is quite key in behavior change. I think because it's not just one thing. You're not just going to say that silver bullet, we've solved it, everyone's cycling and walking to work. It requires various different things happening all at the same time. So, for example, there's no point having a cycling campaign. So there's loads going on in the NHS this year. There's something called NHS 1000 miles in celebration of its 75th birthday. You've got obviously Clean Air Day, Cycle Week. There's loads going on all the time. There's no point having a campaign if it's not supported with, a togetherness. So bike user groups are quite popular in certain trusts, again, where you can meet like-minded individuals, share sort of stories, whatever it might be. You feel part of something, you're part of a community. That can influence behavior change. On top of that, you've got sort of doctor bike sessions. So if you've got a part of your bike that's broken, rather than going to Halford, Dr. Bike will come onto the site and will fix that for you. And then I would say you need accessibility. So a lot of people don't cycle into work because it's not safe. They don't feel comfortable cycling in London, whatever it might be, the roads aren't great. So again, can we provide information about safe cycle routes? When they get to work, they need to shower, they need to lock it up in safety. They don't want to have the risk of sort of their bike maybe being nicked. So it's all of these things, I would say, combined with cycle to work schemes, which is an obvious one. If you're not comfortable cycling, can we do sort of e-bike, sort of monthly loan sorts of things? There's some organizations now there where you could rent an e-bike on a monthly subscription like Netflix. So there's loads out there, and it's not just that silver bullet. You can't just install some, cycle shelters and expect everyone to cycle. You need a campaign, you need to build a community, and then you need to install that infrastructure to enable people to cycle.
It always blows me away about how much good stuff is going on behind the scenes here. Jonathan, before I kind of move on to your next question, is there anything you want to add from, obviously it's a long time since I've gone around the panel, to back to you, about anything else that's going on in the ambulance service, sort of on the more general modal shifts, if you like? Oh, I've lost your sound again. Sorry, I've lost your sound. Just
hi.
again, if you don't mind.
Can you hear me now?
Yeah, I can hear you now.
Yeah, I'd say one of the big things is the increase in people working from home. Actually, that has been a significant drop in business miles being claimed by about 50% actually. So since COVID, so that in itself is a change, a modal shift in working behaviour. So obviously, there's going to be lower carbon emission from the saving on transport. Slightly offset though by the increased emissions from people working from home and having the heating on, etc. But yeah, that'd be the most noticeable one for us.
Just going back to your electric vehicles, you talked about some of the kind of challenges you're overcoming at the minute. Have you looked at the buildings yet to accommodate EV? Have you started that process? And if so, how is that going?
Yeah. I mean, it's already been touched on. One of the big problems we've got is parking. It's just a huge issue, and just the logistics of the parking as well. So that the spaces could be quite haphazard and just wherever people can squeeze a car in, and that makes it quite challenging for people to access chargers. That's just for people's own use, but also then how do we prioritise the use for the emergency vehicles? So we're really scratching our heads with this now, especially with the older sites, and we're having to just try and figure out the best that we can do with what we've got. But obviously, with any new sites, all this will be figured out at the planning stage. But yeah, we're really struggling with that. So we're just going to have to do the best possible with the circumstances.
Yeah, it's a massive problem. I mean, Chris has just said that, I think it's probably aimed at John, but, do you find charging points stay occupied when the car's charged and not freed up to allow other vehicles to charge? I know in London when the taxis converted to, well, actually hybrid. So I think they do 60 miles on the electric, but they're hybrid vehicles. They have special EV charging bays for taxis only in London, but they're not... what do you call it? They're not monitored. So I could park in a taxi EV bay and not be fined or ticketed or clamped. And so people who need to get on them can't. And I suppose Chris is wondering whether you find that people stay and then it's blocking spaces. John, have you had that problem?
Approach here. So we've got a policy which sets out a 3-hour restriction on parking in EV bays. So that's relying on people's good manners, etc. But also we've got an app which allows and it provides a prompt. You put your vehicle registration in and it provides a prompt if somebody's waiting to get in the space. But it gives people, if they're in the middle of a meeting, they'll just get a text alert to say that, someone's waiting to charge up. So it's sort of relying on people's good manners, really, more than anything. So there's nothing, but we are also, we are also policing it with our car parking team. So if people are staying in, we're looking at 3 hours, which gives you about 30 odd miles for people to get home. That's the restriction. So it allows you that commute rather than letting people stay there all day and get in. And also manufacturers recommend only 80% and not continually charge your vehicle up to 100%. So we're looking at 3 hours and then for people to move on.
Stewart, parking's always an issue, isn't it, at hospitals? I don't ever remember going to a hospital where it's either not been difficult to park or, it's always in demand, whether you're staff, patients, visitors, etc. And I'm just wondering what effect, if you implement a robust staff parking policy, what effect does that have on staff morale? Is that an important thing to do in your opinion?
Yeah, definitely. I mean, it does have a massive effect on staff morale, staff retention, and everything that comes with that. So it's important that when you do it, that you listen to staff, and when you want to implement your policy, you don't have hard and fast rules on it, and you can make changes to it on the feedback that you get from staff. Our consultation it started initially as 2 months. It actually ran for over 12 months while we got it right to listening to staff, and as part of the consultation we implemented things like shuttle services that ran on demand overnight that took the staff back to the car park where they were parking, because obviously staff that work in twilight shifts and things like that did not want to walk through the centre of Bristol to get back to their vehicles if they have no other option but to drive. So yeah, it's important that you listen. It's important that you don't worry about attending stakeholder events and anything like that. You are going to get shot at. There's no getting away from that. But as long as you listen and you can demonstrate that you've made changes on what you've discovered, then it's not as painful as it all seems.
And I was about to call you George there, John. George says, John, has there been much resistance or any negative feedback from staff groups regarding having to use shuttle buses, etc.? From experience, one of the biggest barriers to eco improvements is convincing staff to change their habits. How have the staff reacted where you are? Have they been very much on side?
I think that's more directed to
Stewart.
Stewart, yeah, sorry.
Sorry, Stewart. I'm getting Stewarts and Georges and Johns all muddled, but it's the end of the day now.
Yeah, I mean, there was initial sort of resistance to it because unfortunately during the pandemic, as with everything else, our bus service became a little bit unreliable, shortage of staff, all those sorts of things, the national shortage of bus drivers that we all hear about. But now, as we've invested quite significant amounts of money in shuttle services, for the times when the staff actually need them to get to and from the workplace, they're full up. So staff are moving to that mode of transport because they've got in all honesty, they've got no other way, because we're not enabling them to park on site, and they've accepted it. So yeah,
Good.
that's what they're doing.
Just a final thought, really. Perhaps if I can throw the final thought to you, James, is that following on from what Claire was saying, I thought her story, I don't know whether you heard Claire's speech, whether you were online for that, but hearing her story of being a clinician and dealing with children with asthma and respiratory problems, that kind of really brings it home to me. While we're, one of the reasons, obviously, climate change is a massive reason why we're all making these changes, but also at the same time, that wonderful benefit is tackling air pollution and hopefully making us all healthier at the same time. How can we measure the impact? Because I think if we can measure the impact and feel something tangible, presumably that then helps, get people behind what you're all trying to achieve on this panel, and what certainly I'm trying to achieve in my small way in my life too.
Yeah, I did hear Claire's story, and I agree. We often find that GPs are very passionate about air pollution purely because they're dealing with patients through asthma reviews, and they're seeing firsthand the impact that this is having on patients. It's finally reaching the mainstream. Obviously, if we can reduce our sort of carbon emissions, we can reduce our admissions into the NHS. It makes sense from a health perspective. It makes sense from a cost perspective. And air pollution is one of those key areas where it aligns various different topics and really sort of is firsthand showing how climate change impacts on patient health. In terms of impact measurement, this is the challenge, right? And this is one of the issues why it's not being mainstream. It's sometimes very difficult for the NHS to say, if we can sort of reduce our PM2.5, PM10 and sort of nitrous oxide, and then all the other sort of pollutants, it would lead to this amount of sort of reduced patient inflow, it would lead to this amount of cost save. There's been some studies in the past, I think 2018, there was a government study, but it's very, very difficult to quantify the impact of mitigating air pollution. However, there is some things being done. At a large scale, there's two pieces of modelling work which is currently taking place. At Northumbria University, there's a PhD looking at the Clean Air Hospital Framework and again, how it can be improved, how to quantify those impacts. And likewise, Global Action Plan are doing some air sort of pollution modelling as well. On the ground, really exciting project happening at Guy's and St Thomas that has by far sort of led the way in terms of sort of air pollution projects and activity. So they're working with an organisation which is sort of monitoring air pollution levels at delivery units. Again, looking at this over a month's period, combining this with training on the ground to people working to advise against idling, also writing air pollution within supply contracts and looking at over a month, looking at where the peaks are, identifying what the sort of the deliveries are at that time, and then engaging with those suppliers to change their behaviours. So again, it's very small, but it's using data to be able to influence the way certain stakeholders behave around air pollution. So there's still a long way to go. We need to get to a point saying, if you can do this, it leads to this amount of money saved, and it leads to this amount of sort of patients not being to be seen by the NHS. But we are quite a way away from there, unfortunately.
Oh, well, it's a good place to leave it, because it linked us back to our earlier panel about what we can do with our supply chain, and also data has been, we all seem to have a key theme. Often it's collaboration, and I think in today's event it's been data and the importance of data. So thank you for sharing, to all of you, for sharing the experiences and the challenges that you're facing and solutions. So massive thank you to James, Stewart, John and Jonathan for joining us, and a big thank you to everyone who's joined us for the conference today. Thank you to our partners, as of course we couldn't hold these events without your input and expert industry knowledge. And I'm hoping that I'm going to see many of you at our next event, NHS Workforce, which takes place on the 1st of June. Please do share the word with your colleagues. They of course would be very welcome too. Just as a quick reminder, today's event was CPD certified, with 1 CPD point earned for every hour of live content watched. So if you'd like your certificate, please email marketing@cognitivepublishing.com. So from me and everyone at NHE 365, enjoy the rest of your day. Bye for now. You were shaking the table.